Today we'll have a class on septic abortion. Septic abortion is a serious medical condition characterized by infection of the uterus following an incomplete or missed abortion. It poses a significant risk to women's health and require a prompt recognition and intervention to prevent severe complications including sepsis, organ failure and death. Nurses play a crucial role in the management and care of patients experiencing septic abortion. Their responsibilities include early identification of symptoms, providing supportive care, administering medications, and collaborating with the healthcare team to implement appropriate treatment plans. Understanding the pathophysiology, risk factors, clinical manifestation, and treatment protocols for septic abortion is essential for effective nursing care. In this context, the importance of aseptic technique, infection prevention measures, patients' education, and compassionate care cannot be overstated. By equipping themselves with knowledge and skills related to septic abortion, the nurses can significantly contribute to improving patients' outcome and ensuring a high standard of care for affected women. First, we'll see the definition of septic abortion. So, any abortion associated with clinical evidence of infection of the uterus and its content is called as septic abortion. Abortion is considered septic when rise of temperature of at least 100.4 degree Fahrenheit, offensive or purulent vaginal discharge, lower abdominal pain and tenderness. So what do we mean by tenderness? Tenderness is a pain or discomfort when an affected area is touched. It should not be confused with the pain that a patient perceives without touching. Pain is patient's perception, while tenderness is a sign that a clinician elicits. We'll move on to the next slide, that is the incidence of septic abortion. So the incidence goes like this: about 10% of abortion requiring admission to hospital are septic abortion. Most of the septic abortion are associated with incomplete abortion. In majority of cases, the infection occurs following illegal induced abortion, but infection can occur after spontaneous abortion also. Moving on to mode of infection. So the mode of infection is endogenous infection. The microorganism involved in the sepsis, usually those present in the vagina. So the anaerobic bacterioid group, anaerobic streptococci, Clostridium welchii and tetanus bacillus. Aerobic Escherichia coli, Klebsiella and Staphylococcus. So regarding the endogenous infection, so it may be endogenous infection. Here the main cause or mode of infection is endogenous infection. So the opposite of endogenous infection is exogenous infection. So exogenous infection means the exogenous infection occurs when a pathogen enters a patient's body from their environment. For example, inadvertently spread from the contact with the contaminated surface. In contrast, endogenous infection, the body's normal flora of microorganism may become pathogenic. That is called as endogenous infection. So here the mode of infection is endogenous infection. Moving on to the pathology of septic abortion. So here the infection colonizes in necrotic product of conception. That is the first initial stage. You can see actually it is categorized as grade 1. The infection colonizes in necrotic product of conception. Next it leads to endometritis. So endometritis, it comes under the grade 2. Later on the spread of infection beyond to uterine wall and lead to peritonitis and septicemia, which comes under grade 3. So this is a pathology which you can see. So the infection first will be in the area that is colonizes in the necrotic product of conception. Later on the endometrium get infected and that leads to endometritis, that is the inflammation of the endometrium. Later on that comes under grade 2. Later on it moves to grade 3 if not treated during this period. The spread of infection beyond to uterine wall and lead to peritonitis and septicemia. Moving on to the clinical features. So what are the clinical features which you are going to see in case of septic abortion? Of course, the history of amenorrhea, vaginal bleeding which is followed by a foul smelling vaginal discharge, pain lower abdomen, products may or may not be expelled, and fever with chills. The signs, the maternal vital sign shows high temperature, tachycardia, septic shock, jaundice, oliguria, anuria, poor abdomen tender, lower abdomen, tender and rigid abdomen in generalized peritonitis. In pelvic examination, you can see the gravid uterus is felt same or smaller size and it is firm, tender on movement, closed or open os, foul purulent discharge from the uterus. So these are the signs which you can see in case of septic abortion. Moving on to the investigations. So the routine investigations include cervical or HVS, that is high vaginal swab, is taken prior to the internal examination. The culture in aerobic and anaerobic media to find out the dominant microorganism, sensitivity of microorganism to antibiotics. Smear for gram stain, that you are going to check for gram negative organisms or gram positive organism. So in gram negative organisms are E. coli, Pseudomonas, bacteroid, etc. In gram positive organisms, Staphylococci, anaerobic streptococci, Clostridium welchii and Clostridium tetani, etc. Blood for HB, blood grouping and RH typing. So these are the investigations which you are going to do for this condition. Speaking about the aerobic and anaerobic bacteria. Aerobic bacteria refers to the group of microorganisms that grow in the presence of oxygen and thrive in the anoxygenic environment, whereas anaerobic bacteria refers to the group of microorganisms that grow in the absence of oxygen. Moving on to the special investigation. The special investigations which are performed are ultrasonography or ultrasound pelvis and abdomen to detect intrauterine retained product of conception, pyometra, foreign body, intrauterine or intra-abdominal free fluid in the peritoneal cavity or in the pouch of Douglas, X-ray abdomen and pelvis. So what is this pyometra? Pyometra is a serious and potentially life-threatening infection of the uterus that causes it to fill with bacteria and pus. So this condition we call it as pyometra. Blood investigation, which includes blood culture if associated with spell of chills and rigors, serum electrolytes as an adjunct to the management protocol of endotoxic shock and coagulation profile. Moving on to the complications. So the complications of septic abortion, that is immediate complication. The major complication of septic abortion are dependent more on the nature of the abortion in which the sepsis occur. Practically, all the fatal complications are associated with illegally induced abortion confined to the grade 3 types. Hemorrhage related due to abortion process and also due to injury inflicted during the interphase. Injury may occur to the uterus and also to the adjacent structure, particularly the gut. So these are the complications, mainly the hemorrhage which is related to abortion, and the second thing is injury may occur to the uterus and also to the adjacent structure, mainly the gut. The complications which include due to the spread of infection, which leads to, the first one is generalized peritonitis. The infection reaches through the uterine tubes, perforation of the uterus, bursting of the microabscess in the uterine wall and injury to the gut. The second one is spread of infection leads to endotoxic shock. mostly due to E. coli or Clostridium welchii infection. Third one, it leads to acute renal failure. Multiple factors are involved, producing a patchy cortical necrosis or acute tubular necrosis. It is common in infection with Clostridium welchii. Fourth one, it leads to thrombophlebitis. All these leads to increased maternal deaths, the magnitude of which is to extent of about 20 to 25% as per hospital statistics. The risk is about 50 times more in illegal induced abortion than in the legal abortion. So these are all the points which comes under the complication, that is immediate complication. So under immediate complications you have main thing is hemorrhage, and the second thing is injury may occur to the uterus and also to the adjacent structure. But if there is a spread of infection, then it leads to generalized peritonitis, endotoxic shock, acute renal failure and thrombophlebitis. Moving on to the remote complications. So these are the listed down complication as a remote one, that is chronic debility, chronic pelvic pain and back pain, dyspareunia, ectopic pregnancy, secondary infertility due to tubal blockage and emotional depression. Moving on, as we say that prevention is better than cure. So what are the prevention measures to be taken here? To take a meticulous antiseptic and aseptic precautions either during internal examination or during operation in spontaneous abortion. Second one, an inevitable or incomplete abortion should be made complete as early as possible. Third one, to boost up family planning acceptance in order to curb the unwanted pregnancy. The fourth one, rigid enforcement of legalized abortion in practice and to curb the prevalence of illegal abortions. Education, motivation and extension of the facilities are a real benefit here. Moving on to the management of septic abortion. So the general management. General management includes hospitalization even with the case of mild infection is preferable. To take high vaginal swab or cervical swab for culture. Vaginal examination is then made to note the state of the abortion process and extension of infection and then cleared. If the products are found loosely lying in the cervix, it should be removed by a sponge holding forceps. Overall assessment of the case is to be done and the patient is put in accordance with the clinical grading. The line of treatment includes to control the sepsis, to remove the source of infection, to give supportive therapy to bring back the normal homeostasis and cellular metabolism, to remain vigilant in order to assess the response of treatment. So the management for grade 1. So as we have discussed, what is grade 1? The grade 1 is the infection colonizes in the necrotic product of conception. So the treatment here is the drugs, antibiotics, that is anti-gas gangrene serum 8000 units and anti-tetanus serum 3000 units intramuscularly. Along with that, you can give analgesics and sedative. The other treatment include blood transfusion, that is early and adequate blood transfusion is not only helpful to improve the body resistance and anemia, but it is also effective to prevent or minimize the shock and oliguria. Next point is evacuation of the uterus. As abortion is often incomplete, evacuation should be performed in a convenient time within 24 hours following antibiotic therapy. Excessive bleeding is an urgent indication for evacuation. Early emptying not only minimizes the risk of hemorrhage but also removes the needles of infection. Gentleness and avoidance of vigorous curettage are to be followed to minimize the risk of injury to the soft uterus and spread of infection into the deeper tissue. The condition in grade 2, that is drugs, antibiotics, mixed infection including gram-positive, gram-negative and anaerobic organisms are common. Ideal antibiotic regimen include If it is a gram positive aerobes, you are going to start with aqueous penicillin 5 million units IV 6th hourly, ampicillin 0.5 to 1 gram IV 6th hourly. If it is a gram negative aerobes, then gentamicin 1.5 mg per kg IV every 8th hourly and cefuroxime 1.5 gram IV every 8th hourly. For anaerobes, metronidazole 500 mg IV every 8th hourly or clindamycin 600 mg IV every 6th hourly. Should keep in note, antibiotic regimen must be modified according to the culture and the sensitivity report. Analgesics, anti-gas gangrene serum and anti-tetanus serum are given as we have discussed in grade 1. Surgical management in case of grade 2, evacuation of the uterus. The evacuation should be withheld for at least 48 hours after the infection is controlled and becomes localized, the only exception being an excessive bleeding. If the patient is exhibiting with excessive bleeding, then you have to post her for evacuation on the early basis, or else you can withhold the surgery for 48 hours until the infection is controlled and become localized. The second thing is posterior colpotomy. When the infection is localized in the pouch of Douglas, pelvic abscess is formed. It is evidenced by spiky rise of temperature, rectal tenesmus, and boggy mass fell through the posterior fornix. Posterior colpotomy and drainage of the pus relieves the symptoms and improve the general outlook of the patient. Moving on to grade 3. So in grade 3, the antibiotics is started. Clinical monitoring is to be conducted as outlined in grade 2. Supportive therapy is directed to treat generalized peritonitis by gastric suction and intravenous saline infusion. The active surgery, along with the antibiotic therapy and the resuscitation of the patient with the fluid and electrolyte, the patient should be assessed as to whether active surgery is needed. The indication of active surgery are injury to the uterus, suspected injury to the gut, presence of foreign body in the abdomen as evidenced by the sonography or X-ray or felt through the fornix on bimanual examination. Unresponsive peritonitis suggestive of collection of pus, septic shock or oliguria not responding to the conservative treatment, uterus too big to be safely evacuated per vagina. The laparotomy should be done by the experienced surgeon with a skilled anesthetist. Removal of the uterus should be done by its own merit irrespective of parity. Adnexa is to be removed or preserved according to the pathology found. Through inspection of the gut and omentum for evidence of any injury is mandatory. Even when nothing is found on laparotomy, simple drainage of the pus is effective. So this is a surgical management which you can see in grade 3 type. So today we have discussed about the septic abortion, the introduction, the definition, incidence, mode of infection, pathology, clinical features, investigations, the special investigations which we can do, the complication, that is the immediate complication and remote complication, prevention, management. In management we have seen the general management, the management in grade 1, grade 2 and grade 3. So this is in discussion of septic abortion. So septic abortion is a critical condition that demands the utmost vigilance and prompt intervention from the nursing team. The nurses are at the forefront of recognizing the early signs of infection, providing essential care and supporting patients through this potentially life-threatening experience. By maintaining a high level of clinical competence, practicing stringent infection control measures and delivering a compassionate care, the nurses can significantly impact the recovery and overall health of women affected by septic abortion. Continuous education and training on septic abortion are vital for nurses to stay updated with the latest guidelines and treatment protocols. Moreover, effective communication and collaboration with the multidisciplinary healthcare team ensure comprehensive and coordinated care for the patient. Through this effort, the nurses can help mitigate the risk associated with the septic abortion and contribute to improved patient outcomes, reinforcing their indispensable role in women's health care. I hope today's class was informative for you. If you find any questions, you can please put it in a comment section. Thank you.